Good morning. This is Kelly Hall with the Longview Chamber. We will begin our call at 10:30. We have people still signing on, so we want to make sure that we give it a couple of minutes, and then I will be back with you. Thank you. Chamber of Commerce. On behalf of chambers from across the region, we appreciate you joining us this morning. I'd like to begin with a few housekeeping items. First, this webinar is being recorded and will be made available online at www.longviewchamber.com. For those on the line, you will receive an email later today with a link to listen to this presentation again. And I'd like for you to consider sharing it with other colleagues, businesses, friends, and family. Next, there are a couple of features I would like to make you aware of. Please find the chat and question icons. You can type in both features to the organizer. The purpose of chat today is to make the organizer aware there are issues with the broadcast. The question feature is for you to ask questions of Dr. Anderson throughout the presentation. Dr. Anderson will be answering questions when he has completed his presentation. I will submit the question and direct it to him. Lastly, you will be muted throughout the presentation. It is important for me to share that my team and I are thinking of you during this difficult time. I recognize this is a painful season and our business community is looking for answers. We are in uncharted waters. And while the chamber may not have all the answers, we do have access to experts in specific areas that can provide you with a place to start. Today, our guest is Dr. Mark Anderson with CHRISTUS Good Shepherd Health System. He is our Chief Medical Officer. At this time, I'd like to turn the program over to you, Dr. Anderson. Dr. Anderson, we can see you and we're ready for you to begin your presentation.
Kelly, I can't hear you.
Okay, we can hear you. I'll text Jennifer. Dr. Anderson, can you hear us now?
I apologize. I'm having a little technical problem. I can't hear the Kelly at this time, so let me try to change this computer a little bit.
Joined by phone. My computer speakers aren't working for some reason today, and not being the IT guy I need to be, I'm having a little problem with it. So I'm going to join you by phone today.
No worries. I'm going to turn the presentation over to you now. Thank you.
All right. Well, thank you. Thank you, everyone that can join us. I'm Dr. Mark Anderson. I'm the Chief Medical Officer for CHRISTUS Good Shepherd. My background has been, I've been in emergency medicine trained for over 30 years, and have been a practicing physician until I took the job at CHRISTUS Good Shepherd about 3 years ago. Here today to talk about COVID-19, and probably start off with some facts that many of you know already, but we'll try with that. COVID-19 is a disease that's caused by a virus called SARS-CoV-2. And as you've followed the media for the last several months, it came out of China, where it was originally a virus that infected animals. Particularly, it's related to the virus that causes a disease in bat lungs, similar to SARS. And then through a process called antigenic shift, it jumped to where it can infect humans several months ago. And of course, we've been following the spread of it since that time. The disease that this virus causes is called COVID-19. It seems similar to flu in many ways, influenza, but in many ways, it's also much different. Like influenza, it can cause a variety of symptoms, anything from nasal congestion, sore throat, cough, shortness of breath, fever. It can also affect your intestinal tract and stomach, where you get nausea, vomiting, and diarrhea, although that's a less common symptoms. And it's easily transmitted the way influenza is. It's transmitted through droplets that hang in the air when you cough or sneeze. And then when those droplets land on a surface, they're called fomites. And when you touch a surface, you can transmit that fomite from your hand back to your face or mouth. Unfortunately, many of us touch our face many, many times per day. In fact, many times per hour. It's something that's habitual. We're used to it. We don't even think about it when we're doing it. So you go up and reach out, touch a doorknob where somebody has potentially contaminated it with little fomites from this virus, containing this virus, and then those fomites get transferred to your face, and then they actually can infect you. Because it's transmitted like influenza, it's very easy for one person to give it to another. You've probably heard numbers like the R0 value and various things. They talk about how it expands and grows, but it's actually very easy to catch because of that. Again, very like a cold or influenza. In fact, other similar viruses that infect humans are called coronaviruses as well, but they cause simple coughs and colds. And we react very well. We have immunity to that. The disease very quickly. It's not very severe. And so we don't worry about other coronaviruses right now. This one's called a novel coronavirus. Because it's new to humans, we don't have any immunity to it. And we also don't have a vaccine. That's under development, but the vaccine may take as long as 12 months. We're not sure at this point to develop. And so we have to think of other ways to stop the spread of the disease. When you do that, it's called mitigation. It's really our only weapon against COVID-19, which is what a lot of people are calling social distancing. And social distancing is really ensuring you're not transmitting it to other people. Typically, this disease, one person can easily transmit it to at least 3 other people, potentially every day they're infected. If you look at growth rates, then if you don't do anything to contain it and you don't have a vaccine, it's easily expand within a month. One person can infect eventually 400, can have 400 people actually have it. And so the only weapon, as I mentioned, we have is to create social distancing. When you reduce social contacts, then you actually reduce the rate it spreads. And you try to get to the point of where you have so few social contacts that you have the opportunity to identify someone that has the disease before they spread it. Or hopefully they have the disease and have mild symptoms, get immunity, and then they no longer spread it. So it spreads like influenza, but in many ways, like I said, it's different than influenza. The symptoms range from very mild to actually very severe. And the percentage of patients compared to influenza, if you look at the number of people that are actually infected, the percentage of patients that end up in the hospital is much higher than influenza. And because of that, because of the fact it is a respiratory virus and it attacks the lungs, the people that end up in the ICU and on ventilators as a percentage is higher than influenza. And even though influenza commonly infects many more people than we see in the U.S. every year, potentially 9 million around the United States get influenza, and as far as the severe part of the illness, influenza is less serious than COVID-19. Because of that, we're really being careful in areas where we can to stop the spread by early detection, and then through the action of our public health officials, our county officials and judges, our mayors, our governors, even up to the president, they reinforce the fact that we have to create social distancing until we develop immunity and have the ability to have a vaccine. So that kind of explains the process of the disease and why it's important at this point to really have that social distancing. But social distancing is a little hard. It's not a thing we're used to as a culture. We readily accept that all of us are going to catch colds every year, potentially even catch influenza. Even a percentage of people that get the vaccine still catch it. And we've never really insisted as a society to say, don't come to work sick. If your family members are sick at home, don't come to work. Don't go out in public if you're sick, because the potential of spreading the disease, again, through coughing, through sneezing, or simply through contact and grabbing a doorknob. Once your hand's contaminated, you contaminate the doorknob, and then you transmit it to someone else. This is a very unusual situation for us to have to go through because we've always accepted viral transmission as part of everyday life, which is why it's so important as employers, you start thinking about how do I keep the virus from spreading among my employees? How do I prevent it from coming home to their families? And the number one thing still is social distancing and thinking about how easy it is to spread a cold within your workplace potentially and among your employees. It's the same easy way to spread COVID-19. And so how do you keep it from spreading? Number one is ask employees that are ill not to come to work. And in fact, if they have someone ill at home, ask them not to come to work because they have someone ill at home. Unfortunately, with COVID-19, we believe there's a couple days before you really get fever and severe symptoms. You may only think it's allergies or a little runny nose or a little cough, a little minor cold. And in fact, you're spreading virus at that point with COVID-19. So even during the early stages of infection, it's possible to spread it. That's why it's so important that even if you have family members at home that are ill, you should stay home too. The employee should stay home because they could spread it before they even know they're significantly ill to someone else in the workplace. Besides that, we talk a lot about hand cleaning. We talk about the fact that often you transmit this virus from a surface to your face through touching or contacting a surface. So regularly cleaning your hands is very, very important. The same way for commonly touched items in the workplace, like doorknobs or counters, surfaces, even keyboards, you have to think about if someone's hands are contaminated, they're going to contaminate that surface or that object. So it's important to clean those on a regular basis also to prevent the spread of the virus. Coughing. Coughing and sneezing, again, are ways to contaminate not only surfaces, but to transmit it from one person to the other, because sometimes those droplets hang in the air for a couple of hours, depending on the environmental conditions around it, and the virus can live in those little tiny droplets that hang in the air. And so you want to make sure that you have at least 6 feet between people. Preferably, you're not going to be around anybody that's coughing or sneezing, but you want to have some distancing between people. And you want to make sure that if you are going to cough and sneeze, even if it's just due to allergies, nobody knows if it's allergies potentially who are around you, or is it potentially the spread of COVID-19. Cover your face with your elbow, cough into your shoulder or elbow. Don't use your hand to cover your cough or sneeze, because then you simply contaminate your hand and run the risk of transmitting it to a surface. So screening employees becomes very important. We're doing that in our hospitals. We're screening both our visitors and our associates and employees, even the physicians that come in the hospital for symptoms. to make sure that nobody's entering when they have a fever, if they've had a cough or cold, if they've been around anybody, particularly if they've been around anybody that has had or been suspected of having COVID-19. But anybody that's been ill at home, we ask them to really consider not coming to work. And if they do come to work, we're actually going to ask our associates very shortly moving forward to wear a mask at work, because the mask doesn't protect you from catching it from someone else. The mask helps you from preventing, during coughing or sneezing, spreading the disease to someone else, which is why you're hearing encouragement to even wear now masks in public. Again, it's not to protect you, it's to protect you from spreading potentially disease that you don't know you have to someone else. So there's a lot of things you can do in the workplace that we're doing in our hospitals because of what we're doing in our hospitals. And I talked about screening our employees, cleaning surfaces on a regular basis. We clean things very, very regularly. We're using compounds, and simple bleach wipes, like Clorox wipes and things like that, can actually kill the virus very, very easily. So we clean surface regularly. We clean doorknobs regularly. We screen our employees and associates. We teach everyone about hand hygiene. We teach people about how to cover your cough, how to cover your sneeze. And because of that, our hospitals are very safe places right now. We have been planning for this for many, many weeks. CHRISTUS Health has developed strategic plans, and many of those are in place to respond to different levels of our disease in our community. We don't want it to end up like in New Orleans or in New York, and so I think the actions we've taken early are very, very important, again, through mitigation to prevent the spread of disease in our communities. And right now, we've been pretty successful with that. We see the spread in our communities is very, very low. We do see some community spread as opposed to spread from someone traveling from out of state or from out of the country. Now we're seeing some slight spread in our communities, but it's not severe yet because we're getting in front of it with our social distancing and our mitigation strategies. So with that, Kelly, how about I turn it back over to you for some questions?
Excellent. We do have some questions. What are the most common myths? Are you there?
Yes.
Okay, Dr. Anderson. The first question is, what are the most common myths about COVID-19 that physicians should dispel for patients?
The most common myth is probably, this is no worse than influenza, we shouldn't worry about it. At least it was a common myth initially. I think a lot of people wanted to believe, and we didn't have great information initially coming out of the foreign countries it originated from. But a lot of people were initially saying because not as many people were infected, it's not as severe a disease as influenza. And it's true, not as many people are infected as influenza, but the severity of the disease, the percentage of people that actually end up in the hospital is much higher. And so we want to prevent it from spreading like influenza, where millions and millions of people would be infected because that many more people would end up in hospitals compared to influenza. I think that's probably the most common myth I've heard.
When should individuals who think they have COVID call their doctors?
Anytime you're concerned about cough, cold, sore throat, abdominal pain, many of the symptoms of influenza, the best thing to do is don't just drive to an emergency department and get evaluated, or drive to your doctor's office. Call and talk to your doctor. And your doctor's going to do similar screening questions to what we talk about with our associates, and then ask you about things like travel. Have you been around anybody that potentially has had COVID-19? And if they believe that you need testing, at that point, they would be able to direct you to one of the outpatient testing centers. That's probably the best thing to do, is contact your doctor and go through the questions with them, and they'll determine at that point whether you need testing or not.
Good deal. How are patients treated once they have been confirmed with COVID-19?
It varies a lot because the symptoms and severity of illness varies a lot. Many patients can do fine at home, be treated like influenza. They can develop mild symptoms, or they can develop a pneumonia. And even some pneumonias can be treated in an outpatient setting at home. And then some patients actually have severe illness where they require oxygen and additional therapy, and potentially in the worst cases, they would have to actually be placed in the ICU and the ventilator. We'd have to support their lungs and support their breathing with oxygenation and ventilators in order to get them through this. And there's a variety of things we can do inside the ICU. But remember, antibiotics don't work for this. Antibiotics only work for bacterial infections, not viral infections, which is why antibiotics also don't work for colds. And there's a variety of therapies being tried across the country right now with certain medications. Yeah, you may have heard of hydroxychloroquine. There's certain antiretroviral drugs that were being looked at for Ebola infection. Some of the same drugs similar type drugs that we use for HIV type infections that affect viruses that are being tried right now. But all those now are in development with the CDC. And so a number of people are trying things, but we're uncertain what the best medical therapy is at this point.
So this one I'm a little bit confused. I'm rereading it to myself. And it says if a patient, so I'm assuming this person has already been to the doctor. If a patient has been diagnosed, when is it okay to discontinue home isolation?
So that recommendation has been varying. Initially, the CDC was recommending that you have 2 negative tests before leaving and going back out into the public. The CDC has changed those recommendations and haven't looked at it today, quite honestly, because it does change very rapidly. But there's a period of time, they say, now you can re-enter the public after your fever is resolved and you've had symptoms that have gotten better. It's typically, still going to be around 14 days before you should go out in public after you've been diagnosed. But it also depends on the severity of illness, how much you're coughing. And so following up with your doctor, who's actually your treating physician once you've been diagnosed, is best way to do that. And your doctor will keep up with the day-to-day changes, any of them in the CDC recommendations about when to go back out into public and stop the self-isolation.
Okay. How is CHRISTUS managing personal protective equipment supplies during the COVID-19 pandemic?
Well, as I mentioned, CHRISTUS Health, is both in the United States and an international organization. And we've had plans that have been placed and actions that we've been taking since first monitoring the outbreak in China. Through that development, we've been working on securing supply lines for personal protective equipment and reworking our contracts, buying international suppliers. And to this point, we've been having adequate PPE, personal protective equipment, available for all of our associates. But we have to be careful about it because we don't 100% know what the future will bring. And so we plan for worsening scenarios, even though things look really good right now. And so therefore, we have measures and education we partake about what is the appropriate personal protective equipment to use, depending on what working environment you have and what your job is in the hospital. And that we actually also have ways that we can educate our associates on how to reuse personal protective equipment over several shifts or several days, depending on the circumstance and what that personal protective equipment it is. Because of that, we've been able to conserve, be good stewards of our supplies. And as I mentioned, we have adequate supplies at this time.
Can you give some guidance on cleaning, how to clean environments like classrooms, offices, shared workspaces?
Any good cleaning wipe that you would use at home, as I mentioned, anything containing like a Clorox wipe is good. In the hospital, we have specific wipes and chemicals that are labeled for use of what's called emerging pathogens. But fortunately, even chlorine works. So anything that you would normally use that says it's good for decontaminating surfaces, for viruses, cold, influenza, will also work against this. And usually either a spray bottle with a wipe down or those impregnated wipes you can buy in a package are good ideas to wipe down surfaces. Again, doorknobs, commonly used counters, keyboards, Anything where people touch with their hands are the best ideas to touch, best ideas to clean in order to clean up after where someone's touched it.
With the 1-month anniversary of the first case of coronavirus being detected in East Texas, when will we start seeing recovery numbers being sent out?
That's being issued right now on the Texas website. And so our numbers here in Gray County are still very low. Because of that, I'm not really sure when those recovery numbers will start showing in Gray County. We do know it takes a period of time to be documented as recovery, and a lot of people that are initially diagnosed we're waiting 2 and 3 weeks often to determine if they've officially recovered before that information is being posted by the public health department. The public health department is the best source of those answers and that documentation. So I go actually to the Texas website and actually can see all counties. It's a publicly available website and see all county reporting throughout the state.
Thank you. What is CHRISTUS telling their physicians and other support team members to do when they have been exposed to COVID-19?
It depends on the level of exposure. And so the CDC has guidelines that specifically address whether or not a patient was wearing a mask, a COVID-19 patient was wearing a mask, and what level of personal protective equipment the physician or associate was when they came into contact with that patient. And remember, simply walking in a hallway outside a patient's room is not a way to come in contact. It's supposed to be close contact within 6 feet, or being in contact is caring for a patient in the hospital, examining them, helping them with their daily routines, changing bedclothes, that type of thing involves a contact. So we followed the CDC guidelines specifically for that. Sometimes because of the exposure for the CDC guidelines, we actually send some people home and tell them they need to quarantine themselves for a period of time at home and monitor themselves for symptoms. If they develop symptoms, we test them for COVID-19. And certainly even a cough, cold, influenza during that monitoring period would look like COVID-19, and we test those associates and physicians. Other instances per the CDC guidelines, if you've been wearing some personal protective equipment, then at that point, you're not required to go into quarantine or self-isolation. At that point, you wear a mask while you're in the workplace and monitor yourself for symptoms.
Do you believe there is still a chance for a major community outbreak? And what deems it as an outbreak?
As I said, social distancing and mitigation seems to be working well. If we were to potentially relieve social distancing too soon, we could see increased spread. What becomes a community outbreak depends on your definition. One of the things I worry about is our skilled nursing facilities, where we have people that are potentially elderly or have a lot of comorbid medical conditions like diabetes and hypertension, lung disease. I worry about an outbreak in one of our skilled nursing facilities that could end up with a lot of patients, even without widespread community disease otherwise, potentially coming in the hospital. We're prepared for that. We can certainly scale up our response to that within our hospitals. We have beds available. We have ICUs and ventilator availability, but that'd be very tragic. So that'd be something that I consider to be an event I wouldn't want to see happen. So, and I know a lot of the skilled nursing facilities in particular are limiting visitors as well and screening people in order to prevent that from happening.
Has CHRISTUS reassigned space to protect staff?
So I'm going to interpret that as, do we have special areas in the hospital that we use for COVID-19 patients? And we do. in our hospitals, we have areas that we determined that we try to what's called cohort patients together that have either suspicion of disease or have COVID-19. As I mentioned, we have very few patients in the hospital right now, at this point. Therefore, many of our beds are still being used for normal patients. But in the event we were to see an influx of patients in the hospital, we would group them together in particular floors or in particular parts of the ICU. And I think that probably answers that question.
What do you deem as the best mental health resources online?
I'm afraid I'm not probably the person to answer that one. I would have to probably say for someone that's seeking mental health resources, the first place to contact is your physician, who will know specifically what those resources are potentially and be able to guide you, whether it's to online resources or to a physician or practitioner that might be able to assist you with that. If you have particular questions around COVID-19, we've actually established basically a hotline within our 903-606-DOCS number. You can go use that line and get information about COVID-19 and actually talk to an advanced practice clinician about care for yourself, whether or not you need testing, referred for testing, access to physicians to be able to talk to a physician directly, and potentially, as you mentioned, other community resources.
Do we anticipate the need for any large facilities being turned into COVID-19 emergency hospitals, clinics around East Texas, like they did in Houston, New Orleans, and New York?
We don't at this time. Certainly, again, as we've talked about, CHRISTUS Health and all our other hospital systems around here have made plans for worst case scenarios where we would be able to respond to have our major hospitals become the focal points for treating and caring for COVID-19 patients. And it's largely around having the critical care expertise, the ICUs, the ventilator capability. But at this time, we don't see a need to exercise that. We're not at a stage of spread where that's become necessary.
How quickly will results be available once someone is tested now? Before it was taking 3 to 4 days. Have they sped up that process? And then who follows up if someone's positive?
Unfortunately, as you've heard around the country, limitations on testing still exist. Despite FDA approval and waiver of regulations, there's still not enough test kits around the country to provide testing for people with minor symptoms. And so the CDC has recommended, because of that, certain categories and priorities of testing. Particularly that involves inpatients in a hospital, the medical staff that are working with patients in a hospital, and then people that have a variety of conditions, either from age or from, as I mentioned, other medical problems that need to have testing because they're at higher risk of the disease. So limitations in testing still exist. It is possible to have tests run currently. Those tests go to commercial laboratories where, depending on the volume of samples they're taking in and the capacity of those particular labs, it can take up to 4 or 5 days. So those laboratories are bringing more and more instruments online to expand their testing capacity, and more kits and different types of testing platforms are being made available by the manufacturers commercially. And so we expect testing to get better, but right now we still have limitations on it. And because of those limitations, the turnaround time is still several days in most cases.
Are the people being screened enrolled as patients of a health system or in a public health database?
Once a test has been sent, we report those tests to the public health department so they can follow up on positives. Often if you do end up with a positive test, not only will the physician that's responsible for ordering the test notify you, but often the health department will notify you as well. And they'll follow up because they'll have some instructions for you about self-isolation at home, what your family members should do, particularly if you're an outpatient. Of course, you're in the hospital and we get your test result back, your treating physician in the hospital will let you know immediately. But we do report all people that are being tested in our facilities, as well as positive tests, to the public health departments.
This one I'm a little bit confused about, but I think I understand. Let's say someone has been diagnosed with COVID, maybe even been a patient at the hospital. They are released to go home for home monitoring, but they don't have an adequate support system. What role does the hospital play in providing provision for them after the fact? Or is there any?
So I'd say the hospital tries to ensure everybody we discharge home has adequate home support systems. Home health care still has some access and capability of providing support in the home as well. But again, they're taking precautions to ensure their associates also don't become infected, and they can't care for patients that don't have COVID-19. And then finally, we're asking our public health officials and actually city, county, and other organizations, as well as our volunteer organizations, to look at ways to support those patients at home, whether it's through delivering meals, whether it's through ensuring medications get delivered. So the hospitals play a part of that, but all of our normal other social support systems and government entities play a part of that as well.
Excellent. And the last question that I have right now is, what is CHRISTUS's plans for handling patients from residential facilities and nursing homes? I heard you discuss this was one of your concerns as well.
Well, of course, we wouldn't want to see widespread disease inside one of our skilled nursing facilities, but we would treat those like any other patient and treat them appropriately according to their symptoms, admit them to the hospital as necessary, and then be able to, work them through the course of their disease, assist them in what they need in order to get over the symptoms. And most likely what we're dealing with in those cases is pneumonia. But at this point, regardless of where the patient's coming from, everyone's being treated equally and receiving the same high level of medical care regardless of their age or status.
Dr. Anderson, that is the last question that I have. Would you like to make any closing comments?
Well, just that there's a lot we can do to prevent the spread of this disease. Again, a lot of the common things that we've taken for granted. I've talked about hand hygiene, not going out in public if you're ill, not coming to work if you're ill, screening your employees before they come into the workplace to ensure we're not spreading inside the workplace. A lot of common sense things that we could have done for influenza and colds a long time ago, but because of this novel virus and our lack of immunity, it makes all those things more important than ever. So mitigation is our weapon. Social distancing is our weapon until the time we have vaccine. And it's going to take entire communities rallying together the way we have in Gray County and many of our other communities in order to be able to provide that mitigation and prevent the spread of disease. We want to keep this at a low level where our medical facilities are not overwhelmed, so we continue to deliver care for all types of disease. Then it's important for us to be able to deliver cardiac care, stroke care, trauma care, all those other things that we normally take care of regardless of COVID-19. We can't let care stop just because of COVID-19. And it takes all of us working together as a community in order to be able to provide that.
Dr. Anderson, thank you for taking time from your hectic schedule to help us think through next steps and prepare for the future. One of the roles the Chamber plays is to help create an economic environment that allows prosperity to occur. One of the ways we can respond quickly to our customer needs is by providing relevant webinars like the one we had today. Please be sure and visit the Chamber calendar on our website for a current list of webinars. Together, we will be stronger and we will come through this rocky period stronger than ever before. Again, on behalf of the chambers across East Texas, we appreciate your participation. A reminder, this webinar is being recorded and will be made available online at www.longviewchamber.com. For those on the line, you will receive an email later today with a link to listen to again and share with others. We appreciate you, Dr. Anderson, and for those on the call, have a great and safe day. Goodbye.
Thank you. Thank you.